I'm Mark Laursen. I'm a clinical associate professor of athletic training at Boston University and also the director of athletic training services.
What, during your clinical experience, has made you concerned about your athletes' long-term wellness, especially related to osteoarthritis?
Well, Jeff, I've had the privilege of working at Boston University now, off and on for 30 years. So I saw my first patients at BU 30 years ago, and the privilege of doing that and the perspective of that, a lot of our former patients come back, and I've, over the course of my career, have seen the effects of my kind of bad decisions or aggressive treatments and how it has impacted their lives. So, I now have patients and friends who come back and who have had knee replacements, who have chronic hip pain, and we talk about their experiences as an athlete at Boston University and how important it was to them. But I think they and I both have some regrets on some of the decisions we made then, and I certainly come to understand that in my early career I never talked to patients about the long-term effects of the decisions they were making. And I think probably mid-career I started with really serious injuries, spine and neck, starting to say, well, you want to be able to play with your kids. And I think over the past 4 years or so, I really have started to have more conversations about, as it's become more and more clear to me, that some of the interventions we do, especially in the knee, are going to lead to osteoarthritis, and that our patients really deserve that information as they're making decisions about meniscal repair or ACL repair, quite frankly.
What tips would you have for a young professional right now?
I think that thinking long-term, staying informed, and thinking about the interventions or the decisions we make or help our patients make, not only what's the impact for the game coming up on Tuesday, but what's impact is this decision going to have on that patient 10 years, 20 years, 30 years down the line. I think some of the work that folks are doing to inform us about that, we really is our responsibility to educate our patients on.